If you're struggling with anxiety or depression, and you'd like help to recover from anxiety and depression, you might consider counseling via Skype. This is a very convenient way of getting the help that you need without having to leave home. Often people are not able to leave home because of their anxiety or even because of their depression. I see lots of people suffering from agoraphobia, and also many of my clients come to me because they have a fear of driving. They have a driving phobia, which stops them going to see a therapist in their office. So if you're suffering from an anxiety disorder like that, or if you just prefer the convenience of being able to have your therapy sessions from the comfort of your own home, then counseling via Skype is well worth considering. We use Skype because that enables us to see each other, and of course being able to see each other will greatly improve the effectiveness of communication, and it will allow you to see benefits in a shorter period of time. In the old days, online therapy was mostly in the form of email counseling, but that's a very slow process, really. It's not as effective. When you can see each other, the amount of communication goes up exponentially. So that's why we use Skype, but also we can use other video formats as well, whatever works best for you. During my sessions, I work on teaching my clients how to overcome their anxiety or depression or whatever they are struggling with using mindfulness. Now, mindfulness therapy has become extremely popular these days, but there still are not a lot of people offering mindfulness therapy, and that's one reason why people search for an online therapist who offers mindfulness therapy for treating anxiety or depression. The style of therapy is quite different than conventional talk therapy, or what is basically described as counseling, although I call this counseling via Skype. It's really not conventional talk-based counseling, but rather an approach that focuses on helping you change the actual underlying psychological habitual processes that cause your anxiety or depression or OCD or PTSD. This is the important thing, being able to change that underlying cause rather than just talking about your emotions. That might provide a temporary relief. It's always good to talk about your problems, but it doesn't necessarily change the underlying process that will continue to cause your anxiety or depression. So that is really the focus of psychotherapy. It's quite different than counseling. So I offer psychotherapy via Skype based on mindfulness. Mindfulness training allows you to break free from these habits that create anxiety or depression. It allows you to bring a great deal of focused consciousness to those habits. And of course, that is essential for changing any kind of habit. Once you illuminate that habit with consciousness, then you begin to regain choice. And you can then begin to change that habit consciously. There are lots of details to how we do this using mindfulness therapy, but I can assure you that it's very effective, and in my opinion it is considerably more effective than CBT, which is highly recommended for treating anxiety and also depression. CBT is good because it helps you work on that process of reactive thinking and changing the habits associated with reactive thinking. But it doesn't always allow you to change the emotion itself, to recover from that emotional pain, to heal the underlying emotional pain that is causing your anxiety or depression or addiction. That is the focus of mindfulness therapy, and we do this by establishing a very conscious and compassionate relationship with your emotions. The best analogy to understand this is to think about how you would comfort a child who was in pain, or a friend who was in some degree of emotional distress. How would you go about doing that? What you probably have discovered yourself is that the most effective way to help someone recover from their pain is by being present, being totally present, often without saying very much, just being totally present and listening rather than trying to fix their suffering. So providing that safe, conscious space is very healing for most people. And we do this with our emotions. We learn how to create that same kind of safe, conscious space around our anxiety or depression. We hold them in that space, and this greatly increases the rate of recovery, of healing. So that's one of the primary principles, if you like, of mindfulness therapy as I teach it. So if you'd like to learn more about this approach, about how to apply mindfulness to heal anxiety or depression or any other form of emotional suffering, then please simply email me. You may ask any questions you have about the process. I will be happy to answer them. And let's schedule a trial session. All the details are on my website. So when you feel ready, reach out to me and let's schedule an online therapy session via Skype. Thank you.